I know. You
Good morning. Welcome back to 1160 AM KBDT News Talk Sports. We're JP, Kathy, and the crew. We come to you live Monday through Friday from 7 a.m. to 9 a.m. But join us for news, analysis, commentary, and debate. Don't miss the Wells Report with John David Wells this afternoon from 2 to 5 p.m. only on 1160 a.m. KBDT News Talk Sports. Today is Tuesday. That means we have our mental health moment, and in studio we have the Something for Kelly Foundation with Patty Giolet, and we've got the Morgan Foundation with Steve Dunn, and very excited for the mental health moment. This is going to be a huge, huge day for us here on the mental health moment, and you don't want to turn the dial at all. We have got joining us Dr. Jasleen Chhatwal, Associate Medical Director, Director of Mood Program at Sierra Tucson. Today we're going to be talking, Patty, about what's happening today.
We are so excited today, John. Dr. Chhatwal is visiting with us, and we're grateful for her because her program at Sierra Tucson is very, very important. She's the director of the Mood Program, and we are going to be talking about mental health and stigma that is associated with it. But at the same time, we're going to also talk about the other side of the coin, over pathologizing your emotions. Dr. Chhatwal, are you with us now?
Yes. Hi, good morning. Thank you for having me.
Good morning, doctor. We are so grateful, especially because she is in Arizona, so she's coming to us very, very early. Are you awake and ready to go?
I'm having my coffee as we're talking.
That's great.
Up and I took a little walk outside and so I got myself going already.
Excellent, doctor. Well, I'm sure that the subject is going to be all the caffeine that you need. After we spoke last week about your passion around mental health and suicide in particular, we do not want to forget that this is National Suicide Prevention Month. But one of the things I definitely want to make sure that we speak about today, because it was something that we got quite animated about last week, is your understanding of the stigma that we need to address around mental health, and at the same time recognizing that not absolutely every single human experience is a trauma. So I'm going to let you take it away from here and talk about both of those subjects.
Wonderful. Thank you, Patty. So I think the first thing Patty and I were talking last week, and one of the things we were talking about is how I moved from a different country to be here for training in psychiatry, since I realized that maybe education here would help me better myself as a physician and really be able to provide the best care possible to people in various places. And I think as we were talking about the cultural differences, I was noting how in India, where I'm from, there is a lot of stigma towards people with mental illness, towards having a mental illness. And it typically ends up being that I would work in the emergency department there. I would refer people to the psychiatrist, and they would not go. They would come back and see me in the emergency room repeatedly instead, because it was just easier to imagine that you had a physical health condition and there wasn't really something wrong with your mind. And I think that piece about thinking that there's something wrong with your mind is where I think stigma really seems to creep in. So in some ways, we all pride ourselves on being sane, on being rational, on being people who think clearly. And there seems to be this overarching belief that if you have a mental illness, then somehow you're not being able to do those things. And I think we all need to move away from that, taking mental conditions like depression, generalized anxiety, and then, potentially more severe conditions like bipolar disorder, schizophrenia. We really need to take these seriously, like we take asthma, we take diabetes seriously, we take cancer seriously. And as we were talking, we were also discussing how it seems that in our culture in the U.S., we're maybe a tiny bit more accepting. It really is based on where you are geographically, and obviously your beliefs within your family, what is taught to you in your community and your social setting. But that we're gradually getting into a place where even grief, which is normal grief, or it can be stresses of life, including financial stresses, other things can start to get pathologized, and we can say, you know, XYZ has depression, whereas it could be that, yes, they are appearing depressed or they're appearing overwhelmed. However, we also not only need to have them go to the doctor and take medicine, but we also really need to help our fellow human beings and ourselves reduce the amount of stress we have and help our children grow into more resilient human beings who can be aware of their emotions and learn to start recognizing and working with them rather than just hoping that the doctor will somehow take care of that alone.
Doctor, I know that resilience is... Sorry?
I'm going to stop here if I feel like good mom.
No, you're doing great. I know that you have so much wisdom and so much passion on this subject. I want to make sure that you have the time to share all of that wisdom. Also, one of the subjects that is very important to you, I understand from our conversation, is the subject of coaching our children into their resilience. You want to visit about that for a few minutes?
Yeah. And I guess before I start, I'd like to hear from the group that's in the studio. What are some thoughts that come to your mind when we say the term resilience?
Resilience, that says to me the ability to bounce back, the ability to come back from a position of strength, even if you were in a weakened position. I guess those are the first couple of things that I would think of when I think of resilience.
Dr. Hyde, this is Stephen Dunn. We haven't had a chance to talk yet, but again, thank you for appearing on the show. In terms of resiliency, I tend to look upon it as, it seems like today in our society, we are trying to make accommodations for everyone. We seem to be classifying everything as trauma or a traumatic event, instead of just acknowledging at times the world is hard. And I believe it's meant to be hard, and yet we want to protect our children so much that oftentimes we don't give them the opportunity to build a resiliency within them. Do you have any type of thoughts about that?
Yes, I really appreciate what both of you said, Steve, as well as I think that was Kathy. That resilience is the bounce back, and you know what we're doing to our children by really clearing the road for them, or taking out all hurdles from their lives when they're younger, is that we're maybe not giving them the opportunity to build their own internal sense of worth and wellness, and hence resilience. So in some ways we consider resilience like, imagine it as a muscle. And if we don't let our kids pick up the dumbbell and, you know, do some weight training of their bicep is going to be weak. It's not going to be a strong bicep. Similarly, if we don't give our children small adversities to overcome or deal with, and don't let them be the ones who lead that change in their life, then we give them the message that I cannot do this life alone. I need my parent to be clearing the road for me.
Doctor, that's
throughout
an excellent point. Can you elaborate specifically on that? Is there a part of your program? Is there part of something that you are aware of? How do parents today coach their kids, guide them into a sense of resilience?
Yeah, I think what we see, since we're mostly an adult program, but we get 18, 19-year-olds and even, you know, patients in their early 20s, is that we're noticing that sometimes parents are in the helicopter parent mode, which is a popular term. And nowadays, I just recently heard a new term, which is called lawnmower parenting.
Doctor, it's
So
so
we just
funny.
clearing-
I was about to say, what about the lawnmower parents? And that's what exactly what you described when you clear the way. That's exactly what you're describing.
Yeah. And what happens then is that in an indirect way, we're giving our child the message that you really can't overcome these things on your own. You need me to clear the path for you. So some of the things that form resilience is having a degree of self-awareness. If we're not letting our children struggle with, say, a difficult relationship with a friend or a difficult interaction with a teacher on their own, I think our job as being parents can be better served if we're teaching our children. We're saying, okay, well, you had this conflict with your friend, Connor. What did Connor say? How did you end up in this conflict? How are you feeling? Oh, I realize you're feeling sad about the potentiality of losing this friendship. And this other thing you're expressing is called anger. And so in some ways that helps the child build self-awareness. Then we can help them decide what is it that they want out of that relationship. So what is the purpose associated with the interaction? And really help them build positive relationships, help teach them how to care for themselves and how to really start working through difficulties that we all will come across in our lives. So even, the loss of a pet or loss of somebody nearby, it doesn't mean that we say, oh, well, child, somebody died, death happens. It's really more saying, these are things that happen in life. This is how you're feeling. I'm here to support you through this and to help almost collaborate with the child in helping them come through difficult situations.
Do you explain to them how to handle that relationship with those emotions? Do you coach them? How do you feel about this feeling of anger that is human and understandable? How do you explain to them how to relate to emotions that don't make them feel good?
So that is part of the program, and part of what we try to do individually with patients is we help, especially young adults, build a degree of awareness around emotion and then acceptance that yes, even things that don't make us feel good can be healthy things. So that anger is essentially a protective emotion, and it tells us that something in our interpersonal relationship is uncomfortable, that somebody's encroaching upon what we think to be fairly private. So we do a lot of talking about and training around interpersonal boundaries, knowing where, I end and the other person begins, and how to really navigate that piece where you want to ask for help, you want to have other people positively involved in your life, but also when they start stepping into your realm and trying to do things that are more personal to you, that you should be able to do, then to be able to say, thank you for helping me so far, I'm going to take it from here. And so when we have an aspect of our program called Family Week, where families are invited into the program with loved ones, so whether these are older adults, 30s, 40s, or young children, whether these are people who are going through retirement in their 60s, 70s, we tend to invite family members during the third or fourth week of the person's treatment. And the family member goes through a similar educational program and therapeutic program for about 4 or 5 days, along with their loved one, to really start to understand what their loved one is going through, what are healthy ways of helping, rather than the term that we hear, enabling, which is, just taking the bag of everything that the person is dealing with and dealing with it yourself.
Doctor, I've done a deep dive into the industry here in the past year or two, and it seems like we're hearing more and more talk these days about microaggression and macroaggression and trauma with a capital T and trauma with a small t, and bringing social justice issues in the counseling process. Are we at a point where we also need to start to retrain the therapists and counselors out there about resiliency and what actually is trauma and what is not.
Yes, and I think there is partly the fact that, that's where some of the over pathologizing can also come in, where we can say, well, I'm so traumatized that I can't live my life. And I think the trauma informed care model, which comes up, which essentially is along supporting the small c, and also the capital C, is that we're really saying, that we want to ask permission and ask for the patient's collaboration in care. It doesn't say that everything bad that you may go through makes it so that you can't live your life. And so the trauma-informed care model.
We're going to go to break, Doctor. If you'll hold on for just a moment, we'll be right back. We are 1160 AM KBDT News Talk Sports, and we're JP, Kathy, and the crew with the Mental Health Moment. We'll be right back.
Break on the radio.
Great
right
job.
Listening.
Great job, Doctor.
Super.
We're on Facebook right now.
Super pro, John.
As we all have been speaking over the last few weeks, we want to continue to make the program in between also productive, Doctor. So even though we're not on the radio, we are still on Facebook. Could you talk a little bit about what you and I spoke of the other day about what is trauma? You have just a couple minutes to do it. We've got about 3 minutes on this break. So if we can kind of keep that explained in there, that'd be awesome. Go.
So I think trauma is essentially anything negative that essentially overwhelms your capacity for coping with it, right? And so everybody's capacity for coping can be very different, and that is where that piece about resilience comes in. And so when we talk about trauma-informed care, it's really more sensitizing healthcare providers and others that you want to ask permission from the patient to offer them care. You also want to give them a sense of control rather than saying, well, I'm the doctor, let me tell you what needs to happen. And then also helping the person find adequate support so as to continue on their journey. And this is something that is a really helpful way of providing healthcare in general, the trauma-informed care model. However, I think that is where it sometimes has gotten into the realm of getting used for everything that happens, that people can start to use that almost as a cop-out for continuing to work through things that they're dealing with. So the fact that we have something difficult happen to us doesn't mean that then that should make us disabled. However, I think it's a balance of how much trauma and how early in life you endured it. And then secondly, the resilience that is built up. So we all know people in our social circle where we say, oh my God, that person went through so much and look how they're carrying on. And that really isn't that they're of a stronger mindset. It may be that the balance between the amount of difficult and traumatic experiences that they've been through and the degree of resilience that they had was a little bit in the positive. And there is a genetic component that comes into this, which is that if you are at higher risk for mental health conditions, especially conditions like anxiety and depression, then that can generally lower your resilience. But you can continue to do things to improve your own ability to know yourself, to seek help early, to be a real collaborator in your own care.
And we've got about 1 minute before we come back on. Real quick, along those same lines, and you hear this a lot with kids nowadays because everybody feels entitled and they compare themselves to everybody else. What do you do with kids who say, well, my life's been so much harder than other kids' lives because my parents got divorced or because I had this happen to me or this happened to me? How do you handle that? It's almost like a sense of entitlement, but they're young, and how do you handle that and coach them down that, well, you know what, sometimes worse things happen to other people? How do you handle a situation like that? Because I hear so many parents asking about that nowadays, more so than in my generation. I know that.
Yeah. We try and move away from the
10
comparison
seconds.
typically
Good morning. Welcome back to 1160 AM KBDT News Talk Sports. That's right. We are JP, Kathy, and the crew, and we come to you live Monday through Friday from 7 a.m. to 9 a.m. Don't forget to stay tuned for Charlie Jones right after us at 9 o'clock, and then you'll pick up Del Walmsley, Point of View, and John David Wells with the Wells Report from 2 to 5 p.m. We are in the mental health moment and having a great conversation with Dr. Chhatwal. We want to thank our sponsor for making this happen as a result of the Morgan Foundation and Something for Kelly Foundation. Struggling with behavioral health and addiction concerns can be challenging. Selecting the right treatment for you and your loved ones doesn't have to be. Acadia Healthcare's treatment placement specialists, known as TPS, are a free resource dedicated to supporting individuals in need of comprehensive mental health and addiction programming. With access to clinically driven programs across the country, TPS offer higher level treatment options for nearly every demographic, from eating disorders and substance abuse use disorders to anxiety, depression, co-occurring disorders, and trauma-related diagnosis. As a trusted partner to clinicians, families, employer groups, and individuals in need, each TPS strives to empower clients to feel confident in their treatment decisions. Treatment placement specialists work as advocates, carefully considering the personal, financial, and geographical needs of each case with every referral they offer. To learn more about working with the TPS team, visit www.treatmentplacementspecialists.com and contact your local TPS today. Treatment Placement Specialists, improving lives through informed treatment guidance. And Patty, I want to thank Acadia for helping make this all happen. So we're going to kick it back to you and Dr. Chhatwal.
Thank you so much, John. It's important to me and all of us here, I think, that we normalize this issue around mental health. I'm going to focus a little bit on the term mental health and not mental illness, because I think that comes up with a more positive spin. Doctor, I know that it is important to you that each person be treated in a holistic manner and that you have a real positive approach to mental health. So in order to move this into the next most positive approach, talk a little bit about your holistic approach to mental health.
Thank you, Patty. So I think my personal approach to mental health has always been a more health-focused and building wellness approach, and I think that's where I get into the weeds with resilience often. And I think the way to consider health in general, and especially mental health, is that yes, you need your medical doctor when you're in a state of not being able to function, to be a collaborator with you in your health care. However, there are things that we can do on our own, that we can do in our communities, that will help make our communities and ourselves healthier. So I personally also think about, nutrition as a route to having a healthier mind and being able to treat ourselves well. That's where reducing the effect of substances, and especially using, things like alcohol, marijuana, and other things to deal with life can be a very slippery slope. And then from a holistic standpoint, also things which are sometimes considered cliquey terms like mindfulness or, meditation, but really any way of doing some self-reflection, sitting with yourself at the end of the day or the beginning of the day and say, what did I do well today? Or what is the one goal that I have in the day? So it can be something as small as I'm going to do one act of kindness, or at the end of the day reflecting on, my interaction with my cousin was really positive today. But really being able to build ourselves up and helping us recognize all the things that we're doing well, because we're all doing so many things well every day. And I think that's where sometimes with focusing just on illness, we get very stuck on what is wrong. And even for patients who come and spend, 3 to 6 weeks with me at our treatment center, we have to stop after a week or so and say, okay, everybody's been talking to you about what's not well and what you're seeking help for. But let's also look at what are things that are good in your life. What are things that have supported you? And I really like to focus on purpose, because purpose is one of those really big things that helps build your purpose, your resilience.
Thank you so much, Dr. Chhatwal. We appreciate your time here on the show with us. look forward to seeing you again. And in the meantime, I think Kathy wants to throw something over to Steve for a comment.
Steve, next week. And thank you again, Doctor. Steve, next week.
Yes, next week we have Dr. Stephen Holland from Vanderbilt talking about depression in adults. And we'd also urge everyone to remember this Thursday is North Texas Giving Day.
Absolutely.
Find a charity of your choice, and we hope that's going to be the Mental Health Moment, the Something for Kelly Foundation, and the Morgan Foundation at our big event. You can find us on Facebook and on the net about that event.
Well, and we have
All
it
right.
posted on JP, Kathy, and the crew as well.
Yes,
and we'll
we
continue
do.
to share that on our personal pages. Thank you so much. Have a blessed
Thanks,
day, everybody.
guys. Everybody's
Have a blessed
welcome.
day.
And there we go.
All right. Good
Excellent
stuff.
job.
Doctor, you still on the line?
Good job.
No, I think she's off now.
Okay.
Can you please tell her thank you, thank you, thank you? That was all such great stuff. Great stuff.
Good job there, Steve and Patty.
Thank you so much, guys. That's
All right.
Is that-
I'm packing up and
okay.
I'm heading out. I'm getting ready to head back towards Dallas.
All right.
So I'll
Talk
see
to you later,
guys
JP. Say bye to Facebook.
Bye, Facebook.
Bye to Facebook. Bye, Chris Getz.
Yeah, y'all can
Bye,
come over and say
Steve.
bye.
On
Now,
this
come on
side,
over here and
Chris.
get your beautiful face over here.
And she wasn't talking to me about that.
Oh, yeah. Steve, you too. No.
Facebook,
All right, bye, y'all.
Thank you guys for tuning in.
All right. And I put Acadia, I put y'all's, put this in here. Do y'all have a Facebook page? Because I can link it to that.
Yes, www.acadiahealthcare.com as far as I'm aware
That
of.
well, do you have Facebook though?
I'm sure you guys,
Healthcare.
you're all over the place.
It says,
I know we have
let me,
LinkedIn. Yeah.
it's not letting me get.
We'll also, my son pulls this segment from
Would
the
it be,
show.
is that
We
y'all
have an
maybe?
intro
Yeah.
to it. That should be up tomorrow, and we'll have it on the YouTube channel, and we'll post on LinkedIn,
I'll link-
Facebook,
I'll
and
link
send
this
that to
too.
you as well.
Okay. Yeah, and then I submitted the pre-recorded thing last night.
Fantastic. Thank you. JP
Good
sent
job.
that over to
You
the
did.
powers that be.
All right.
Thank y'all. Have a great day. Have a blessed
And I
day.
just need, Kathy, do you have a card just so I can?
I don't, but I can get you my information. Hold on just one second. Bye. See y'all tomorrow. Congressman Van Taylor on tomorrow.